everybody. Uh, we have a 44-year-old businessman who plays sports for recreation, wants a THR which is going to last long and serve him well. So when I'm faced with a young patient who's active and who takes part in recreational sports, or his occupation can have risks of falls, etc., I'm always worried. There's always high wear rate in this patient because of high activity level. They can have falls and trivial traumas, and plus their hips are put through extreme range of motions, and we have to always worry about future revisions also in these patients. So if you look through the literature data, then we can boil down to two bearings, the ceramic on crosslink poly and the ceramic on ceramic, where in this, the ceramic on ceramic definitely scores in the lab data, where the wear rates are almost 1/5 of the ceramic on crosslink poly bearings. But does this reflect into clinical studies? So let's look at a few studies. This is a good meta-analysis where they took 15 RCTs published between 2000 and 2020, where they were 2,813 hips, and they found that both the bearings functions statistically similar when it came to revision rates, dislocation rates, or osteolysis and prosthesis loosening rates. But ceramic on ceramic definitely had a higher squeaking rate, and there was always a worry of fracture where almost 2.3% patients had fractures. Another meta-analysis from 2021 where they had 8 studies, and they directly compared ceramic on ceramic highly crossing poly with a follow-up of 2 to 15 years. Again, the conclusion was similar, that both the bearings clinically function similar, and there were hardly any difference in their revisions or complication rates. Another study of 2015 where they had 8 RCTs and they had 1,700 patients. Their conclusion was the hip functions well in both the bearings, and the loosening and dislocation and osteolysis rates were similar, but squeaking and fracture rates are definitely higher in ceramic on ceramic group, though the ceramic on poly group had slightly higher wear rate. This was the first RCT between a ceramic on ceramic versus ceramic on crosslink poly hip from Canada, and at the end of 10 years, both their groups were functioning equally well, and there was equal amount of revision for different things. This was a match pair analysis from Italy, where they had a match pair analysis between 86 patients, 43 in each group, and they found that the ceramic of ceramic definitely functioned better than the ceramic on ceramic group, and there were about 6% squeakings in the ceramic on ceramic group. Another article which compared the bearings in AVN patients with at least 5 years follow-up. The Harris hip scores were equal in both the groups. The radiographic evidence of osteolysis or loosening was similar in both the groups, but they found that the ceramic on ceramic had almost 1/5 of wear rate as compared to ceramic on highly crosslink poly. But there was a higher dislocation rate and a squeaking rate in the ceramic on ceramic group as compared to the ceramic on poly. And they concluded the new highly crossing poly inserts would definitely function as well as the ceramic with lesser risks of fractures, etc. This was a review article looking at advantages and disadvantages of ceramics. Yes, there were lower wear rates in the lab data, but on retrieved specimens, they found that the rate was much higher than the lab data. Yes, the ceramic particles also have a lower biological activity, but the bigger disadvantage was they found that there were higher fracture rates in the head and the liner, ranging from 0.5% to 5.3%. The newer ceramics, the head fractures are almost now ruled out, so we are just bothered with a liner. So we have to think of the liner fractures, and squeaking rates vary in the study, right from 0% in some study to almost 1/3 of the patients getting this problem. So they concluded that a higher wear resistant bearing surface does not automatically guarantee long survivorship, and one surgeon has to be very careful when choosing a bearing in a young and a very active patient. Now, what are the concerns with ceramic? First is a squeaking, where yes, it is a noise. Patients may complain about the noise and may need revision. History or the literature has shown us that patients do need revisions for squeaking. Fractures is always a reality, and there is a small dislocation issue also with ceramic because of problems. So let's look at fracture. This is a good meta-analysis from Korea, where they looked at more than 10,000 hips from 45 studies with a follow-up of 2 to 19 years. And they found that the ceramic fracture rates has definitely reduced in the newer Delta group. The 4th generation ceramics don't really fracture that much, and it's mainly in the liner now. And they found that there was no correlation between fractures and time that lapses, or the patient's age, or the patient's BMI. this is a very good article from Australia where they took all the ceramic hips from year 1999 to 2029. There are more than 90,000 hips here, and they found that the revision, they had 146 revision, which mainly were alumina. As the mixed ceramics came into picture, the revision rates definitely fell down. So they concluded that the newer mixed ceramics definitely have a lesser fracture rate, but still there is a incidence of 0.79% at 15 years follow-up. The third generation definitely had more problems. So they concluded that implant malposition, 28 millimeter head, short neck shells, shock neck lengths, metal shells with lesser taper angle, and improper seating of head in the trunnion or the liner in the metal shell were the main reason. But surprising finding was that people who underwent revision for ceramic fractures, actually 1/5 of them underwent a re-revision in less than 3 years. So this is very significant.
Can you please wind up?
Okay, so let's come to squeaking. Yes, squeaking is there. It ranges from almost 0 to 34%. There are multiple reasons for squeaking. There's micro separation leading to edge wear. This is also seen in malpositioned hips. Leads to stripe wear, leads to roughness, and leads to vibration. Again, this is a good article where they looked at squeaking rates and they found that it ranges anywhere from 0.5 to 30. Starts at about 1 to 4 years from the surgery. Young, heavier, and taller patients definitely have a higher rate. If you have malpositioned your cup, definitely the rates are higher. If the hip center is not medialized or if there's a high prosthetic offset, then obviously there's a higher rate. Because head neck options and liner options are not there.
Dr. Atul, please give your concluding remarks.
Okay. So ceramics, again, we have multiple liners. So on one hand, we have a bearing which has similar clinical results, but there's a high risk of fractures. It is definitely more expensive. On the other hand, we have a ceramicon highly crossing poly hip, which functions very well. There is a small fault tolerance, and it's not mainly with the technique. Sometimes the bone may not be perfect to allow you to place your cup properly. There's definitely lower dislocation rate, and it's definitely cheaper, which is also a concern in India. You can even have a cheaper option if you can use a hybrid and a cemented and have a straight bearing. Okay. So for a younger patient, I would always talk to the patient and discuss the pros and cons, and would suggest a ceramicon highly crossing.
Thank you. Thank you, Dr. Panghate.